EGM Network.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon and welcome to Community Conversations. We're really anxious every week to find the very most talkative, interesting people in the community. And we have a winner. Dr. Ottuso was with us about a month, 6 weeks ago, and we invited him back at that time because he's just a wealth of information. I'm going to start with the basics. He's a dermatologist.
There you go.
What does a dermatologist do?
Well, basically, we specialize in disorders of the skin, the hair, and the nails. That's basically what we do on a daily basis.
So we hear about the skin part, but not the nails or hair issues.
They all basically arise from all the same kinds of cells.
Okay.
So we are the specialists when it comes to that.
So, I see a lot of women that put on the fake nails, and when they take them off, they confess that they had to do that because their nails are so weak or they're disfigured in some fashion. Is that really that common, or do I just have wimpy friends?
No. Your friends are not, well, they may be wimpy, but not because of the nails. But no, nails can cause problems as far as being weak. But the problem is if you start getting into nail kind of substitutes, sometimes you could also get allergic reactions to those. So, and even infections when they're placed on the skin. So you have to be very careful as to how you take care of your nails. There are some studies that show that some vitamins may help with strengthening the nails. There's also some things you could put on the nails called nail hardeners, which may help with the weakness in the nails. But it definitely is an entity, but you have to be careful as to what you use in order to hide that.
Very interesting. And we won't even go into the hair thing.
It's okay. It's all good.
I would imagine the bulk of what you do, though, is preventative care, particularly of the skin.
Not about preventative, but I think some of it's preventative with skin cancer screenings, for instance, because we're seeing a large number of patients here in Florida and throughout the United States, throughout the world, with an increased incidence of skin cancer. So skin cancer screening is very important. Melanoma is on the rise. We're not really sure why, but screening is an important thing as preventative and also as early diagnosis. Because when you diagnose anything earlier, it's obviously much easier to treat.
Is there any evidence yet? I think back to the 50s and 60s when we just thought putting more oil on us was really good.
Yes, well, I was one of those in the 70s even, using mineral oil. And I didn't use the iodine, but I used the mineral oil because the feeling was at the time that was tanning was great. It was healthy, know, and my mom used to even tell me when I looked a little quote unquote peaked, go out in the sun for a while, you look better.
Well, and there is studies that say that vitamin D from natural sunlight is a really important component of good health.
Well, vitamin D to an effect is if you're using vitamin D supplements, for instance, or if you're on a relatively normal American diet, you should get enough vitamin D in order to keep things going, so to speak. I always recommend for patients, if they want to get some sunlight, 5 to 10 minutes of unprotected sun a day is fine, as long as you don't have any underlying diseases that can get worse because of that, such as lupus, for instance. Lupus gets worse usually with sunlight. But vitamin D in general, 5 to 10 minutes a day should be enough for you, along with your diet, and a supplement should be enough.
Wow. So how did you decide to go into dermatology?
Well, I had done internal medicine first. So I did 3 years of internal medicine. And I was very fascinated by some of the patients that I was seeing then coming in with skin conditions who also had problems internally. So for instance, patients again with lupus. So I delved into researching dermatology, and I found that as a dermatologist, one sees the whole gambit of things from newborn to 100 years old. So you kind of can do dermatologic surgery. You can see pediatric patients, children. You could see adults. You could specialize in pediatric dermatology if you wanted to. So it was a fascinating field in that I felt that I could, mix it up a little bit.
Well, and you certainly have. You've been a Vero dermatologist for how long?
32 years, going on 33.
So he officially retired. I want to make that perfectly clear. But he is volunteering a lot of time to We Care,
Yes.
Which is a pro bono group of physicians in town, actually in the whole county, thankfully, who donate their time for people who do not have insurance. And so we're very happy to say that he's being seen regularly at our 787 building because it is central to Vero. And actually, he told me last time he was on, right across the street from where he used to practice.
Yes.
So he won't get lost.
That's true. I know exactly where to go. And it's actually very, very rewarding. After being in the community for so many years, being able to give back to the community feels really good. And I highly recommend it actually for physicians out there who are considering doing it. I think it would be great to have you guys.
Thank you. I have to say that it's a very well-run clinic adventure
Yes.
in that people sign up on a referral basis, and we take care of walking people through any necessary paperwork, and all the fees are covered. So, for example, if you were checking for melanoma and saw a suspicious spot
Yes.
and decided to take a little tiny piece of that.
Little biopsy?
We don't use that B word. That's a scary word. I was just going to say just a little
piece, okay.
Little tiny piece,
A little piece is fine.
scraping. Yes.
Yes.
That pathology, which can be very expensive on a insured basis, is all covered by the We Care donations.
Yes.
So again, if you are thinking about, gee, I'd really like to do something worthwhile, I have a couple of extra bucks. We Care is a 501c3, and it goes to help those that need the help. Because if you have a spot, and we all have seen over the years, if your mole changes shape or size or color, be sure to contact a physician. You may find it difficult to push yourself to do that if you feel otherwise very healthy. But I'm saying, give yourself a referral to We Care. Don't let that spot change and not be aware of it. When I first came to town many years ago, I was working with a group, and one of the laboratory individuals had an undetected spot on his back that turned out to be melanoma, and he passed from melanoma. And that was it was like a wake-up call. It was the first time I had heard of, someone that I knew actually succumbing to that.
Well, what I'm also recommending for patients now is, especially nowadays with the cell phones that we have, use the camera to your benefit. Take photos, for instance, of your back, areas that you can't see, and keep them in your phone, because if something then down the road does change, may change, you have something to refer to and look back and say, wow, it really has changed, or no, it hasn't. So make use of your phone and take those photographs of those areas that are not as detectable as usual. And those photographs could also be transferred to most electronic medical record systems to be put in your record at the office.
And now the treatment for something that has gone from just ordinary to maybe suspicious, those little scraping things, that technique has changed as well, has it not?
Well, it depends upon, with melanoma, for instance, it depends upon the depth of the lesion. That's the most important. The deeper the lesion, the more aggressive one needs to get as far as treatment goes. So it may vary from a small surgical excision to a larger procedure, depending again upon, most importantly, the depth.
But again, that's life-saving. So
yes,
it's not something,
can be. Yes, yes.
You can't mess around with it.
Absolutely. And you can get melanomas in places where the sun doesn't shine. A lot of people don't know that. So, for instance, you can get melanoma in the eyes, in the mouth.
That.
Yes, in the mouth. So in areas where there is no sun exposure. So I personally had a cousin who passed from a perianal melanoma, which was thought to be a hemorrhoid for 2 years. And it was a melanoma. So you can get them in the female parts also. So these are all reasons why you should have eye exam, skin exam, OBGYN exam, that kind of thing.
And again, Treasure Coast Community Health helps in that regard with anyone who's not insured, because we have a sliding fee scale discount program. So if you have an income of less than 200% of federal poverty level, including your family members, of course, we really discount those fees heavily. And if you are couch surfing or otherwise don't have a permanent roof over your head, otherwise known as homeless, we offer free care for those folks. So again, healthcare for all. It's a combined effort. We Care is a separate organization that receives a lot of our referrals for specialty care, even though we have wonderful pediatricians and primary care providers. They know their limits, and
yes,
they really appreciate the pro bono work that We Care does. You mentioned eye care.
Yes.
That is one of the services that We Care is doing as well. Cataracts, glaucoma treatments, I shouldn't say all, because I don't know that for certain. But podiatry, yeah.
Which brings to a good point. Always have the bottom of your feet and between the toes checked, because you can get skin cancers there. You could also get melanomas underneath the nails.
Wow.
So
now I know why it takes you a while to get through your patients.
Yes, absolutely. So when you go for your exam, make sure you don't have your nail polish on, so we could see underneath the nails to make sure there's nothing there.
Awesome.
Yeah.
We're going to take a short break for a word from our sponsors, and then we'll come back and talk about some other things. Great. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of coastal furniture on the Treasure Coast. Sofas, love seats, dining sets, bedroom groups in the latest styles and colors from Four Seasons, Braxton Color, Riverside, Hooker, Capri, Tommy Bahama, and more. We're the outdoor furniture experts and have anything you need for your outdoor living from Lloyd Flanders, Kingsley Bate, Brown Jordan, and Woodard, including a gallery of maintenance-free furniture from Berlin Gardens and Pollywood. Right now, during our summer savings event, we have lots of great half-price specials, including 50% off on all in-stock Universal Coastal Living collections. And all pictures, lamps, and accessories are half price. Sunshine Furniture, $12.95 US 1 in the Publix Plaza, Vero Beach. Don't forget to visit our outlet and sales store directly across the street that is filled with name brand closeouts. And visit our website at sunshinefurniturecasual.com.
And welcome back to Community Conversations. My name is Vicki Soulé, and I'm the CEO of Treasure Coast Community Health, an organization that started through the cooperative ventures of many of our medical professionals almost 35 years ago. And so over the course of years, we have expanded from just a small place helping migrants and seasonal farm workers and ranchers out in the Fellsmere area to an organization that now has 8 and building different locations. Each of them is meant to increase access, so it's very convenient, where we remove barriers to care, including the payment as well. So we do get a very small amount from the federal government. It helps pay the payroll, so we bring board-certified, educated, and well-respected individuals into our community of care. But for the most part, we're dependent on the insurances that people bring and the donations that we receive. And so through that initiative, when I joined the organization about 17 years ago, we were serving about 8,000 individuals, primarily those in the northern tier of the county. Today, we serve over 28,000 in our various sites. Plus, we maintain healthcare services of all kinds at the local jail. And as we know, there are between 5,000 and 6,000 individuals that visit. Most of them don't stay. Occasionally, some will stay waiting a transfer into the prison system. But thankfully, in our small town, most of them are bonded out within a very short period of time, or work out their jail sentences in lieu of that opportunity. And so those are the folks that we take care of, everyone from the very rich to the very not rich, who might have seen a better day. But through that initiative, then, we have affiliated over the years with the We Care organization, again, a nonprofit that is made up of individual practitioners. It was spearheaded by Dr. Dennis Saver, again, 25 years,
Yes.
30 years ago. I'm sorry, I don't know the exact number.
I think it's more than 25 years.
Yeah. And he helped with a number of different things, including an affiliation with one of the medical schools in our area. And so this is a real give back kind of collaboration. And so it's our pleasure at Treasure Coast to host the clinics that are being done there, since we already have all the medical equipment and lots of resources should, in the event something go wrong. And we never expect that to happen. But I don't think I was working at Fellsmere for more than 2 weeks before the ambulances pulled up and transported some unexpected visitors to Sebastian Hospital.
Yep.
And so it's wonderful to know that you have caregivers who can respond in a moment's notice and do the right thing until the ambulance arrives. So I'm very proud of our staff and the things that they've done. But I'm also very grateful for the physicians and the nurse practitioners and others who come in and help us with the folks that are just a bit beyond our care. It just expands the team that much more.
Well, I think we're grateful also to have you. I think physicians are happy to do this. And again, as I mentioned earlier, it's very rewarding for us to do this, to give back. And we wouldn't be able to do that without you.
Well, we try to make it all possible by having the tools that you need, the personnel you need, so that you can come in, give us 3 or 4 hours of your time. I see the pleasure on your faces when you're there, because it's like, this is what I trained for, this is what I'm good at, and I can't just golf all the time.
This is true. and I didn't realize how difficult it is when, and this is just personally, when you retire, to just shut the door on 32 years of practicing medicine. And from a selfish perspective, having We Care also provides me with an opportunity to continue doing what I'm doing obviously at a lower level, not as much hard work, so to speak. But it's, like I said, it's been
Well, you
quite
go
rewarding.
into medicine because you're curious about how things work.
Sure.
And so for many, many years, you're always seeking what's new, what's different, what can I improve on? That doesn't go away just
Right, that's
because the wife says, let's do something different, let's travel more.
That's true. That's true.
So we were talking about dermatology.
Yes.
Okay, we've got about 5 minutes left.
Sure.
I want to ask you, what are the most common types of skin issues that you were seeing before you retired?
Sure. Well, as I mentioned, skin cancer is big. We see a lot of skin cancerous lesions coming through the office, and precancerous lesions too from years of sun damage. So some of these cancerous lesions, such as squamous cell skin cancer or basal cell skin cancer, are preempted by other growths on the skin that tend to, portend a potentially bad outcome. So some people come in with precancerous lesions that have been there for years due to chronic sun damage. So we see a lot of that. We also see
So
patients...
being a bad teenager was okay. It's just don't continue a lifetime of overexposure to the sun.
True, but even being a bad teenager, studies show that even one bad sunburn, one blistering sunburn, predisposes you more to skin cancer as an adult.
So parents keep slapping that skin
Yes.
lotion on your kids,
Yes.
even though they say they don't need it.
Yep, and I recommend a mineral-based sunscreen such as zinc oxide or titanium dioxide. Try to avoid some of the chemicals that are found in some other sunscreens. So it's a lot.
Zinc oxide, the one that gives you the white nose?
Well, it doesn't do that anymore.
Oh, okay.
It still can, but there are actually formulations now which don't make you look white,
Oh, okay.
but still have the zinc oxide in it.
Okay, good to know.
So you should use at least an SPF 30. Should be water resistant. It should say on the label ultraviolet A and B protective. Those are the two danger rays of the sun. And they're usually water resistant, not waterproof. So we don't have any waterproof sunscreens. So you have to reapply every couple of hours. So don't forget that.
Yeah.
So, but we also see eczema patients with a lot of lesions on the skin from eczema, which can be hereditary. Sometimes it's also due to contact dermatitis from something that you may have come in contact with. We see patients
Like
with
an
psoriasis.
allergy?
Yeah,
Okay.
allergens. We see psoriasis patients, which is a hereditary condition. So dermatology sees a lot of interesting things that sometimes also have, as I mentioned, internal afflictions. So psoriasis can be associated with heart disease, for instance. It could also be associated with diabetes. So
And what does it look like?
looks like usually a red scaly patch.
Okay.
Relatively thicker part of the skin. So that's usually psoriasis. You see it on the extensor surfaces of the elbows, for instance, on the knees, for instance. But sometimes you could have nail changes with psoriasis too. So as I mentioned,
Are there medications that will help, or is
Yes.
that coming back to fixing the original issue?
well, it's a hereditary condition. There are
okay.
medications that could help, and there are new medications now, some of which are topical, some of which are injectable, some of which are oral, which can help with patients with psoriasis too. So we have a larger potential for treatment than we did 20 or 30 years ago.
That's really good to know. And I don't think we've ever had this discussion, but Treasure Coast Community Health, if you write the prescription on that referral, they can use our 340B discounted pharmacy.
Excellent. Yes.
Best prices in town.
Yes.
So that, again, we do it on a discounted basis for people who are low income or uninsured.
Right.
So again, don't be afraid to venture forth and say there is help here in Indian River County.
And if I
through We Care.
recall, the We Care is 18 and older.
That's correct.
Yeah.
That's correct.
So,
Not my choosing, but it is what it is.
it is what it is.
And most of the kids, if you're low income, are covered right now, at least under Medicaid.
True.
So again, we're really trying to focus our efforts on the adults that need it the most. And again, I'm going to guess that skin cancer in kids is not as common as skin cancer in adults as we age.
It's not,
Yeah.
but unfortunately, we do see skin cancer, including melanoma in children.
Really?
Yes. So we have to, anything changing on a child on the skin, again, have it checked.
Okay. And that again reminds us that annual exams are not a moneymaker for physicians. They are an opportunity to talk about and have someone review all the possibilities and catch things early, whether it's early in age or early in diagnosis or early in a disease state. That's always the easiest and best way. And
Absolutely.
we could get people in pretty quickly these days because we have increased our staff in anticipation
Yes.
of our new building out west.
That's right.
Yeah,
Yes.
we're going to be opening that up. The contractors aren't quite done, and so the date's a little wobbly right now, but
Okay.
sometime in August is what we're counting on. So,
great.
yeah, they're putting up the awnings. They've planted
saw that.
trees.
Yes.
It's really exciting for our staff, and we're really looking forward to becoming a part of that Western County.
It's a great location.
Yeah. Well, it's what they call a healthcare desert.
Yeah, I know.
So,
I know.
yeah,
Yes.
but I'm sure that will change
It will.
over this next couple of months. So thank you so much for coming
Oh,
back.
not at all. Anytime.
I learn every day from you, so I really appreciate it. I hope that you have learned something new from us as well, and you'll be back here next Saturday at 4:30 because we always have wonderful guests sharing information for you. So take care and have a happy 4th of July. I may see you around and about, but be safe. Take care now.